I smoked for probably 50 years, I would imagine. When I was a teenager, I started smoking. My wife, Miss Fed McDonald, was the one who insisted upon me going to take this test. To make life a lot easier, I decided I better go and take this test now. In the screening, they had found a small spot, 1 centimeter in diameter, on my left lung. They had to remove the lower portion of the left lung. They tested it and they found, I think it was 13 lymph nodes, and one of them tested positive for cancer. So they scheduled me for the chemotherapy, made me feel like, I really didn't have anything to worry about. And actually, I didn't. So on February 20th, 2018, I was allowed to go back to work with no restrictions.
I think everybody in this country has been impacted by cancer in some way. Is either has cancer themselves or a relative has had cancer.
As you can imagine, the impact is not just on the patient, but his family, his workforce, society in general, and the costs are tremendous.
The Georgia Cancer Center is a prime example of how we're putting a tremendous amount of resources, time, effort, and care into providing the very best state-of-the-art care we can for our patients.
The C-Care project does several very pivotal things. It reaches out to the communities, to those who are at highest risk for developing lung cancer. It provides tobacco cessation for those who are smokers and are willing to try to quit. It trains community health workers within those faith-based organizations to deliver the curriculum. It is a wrap-around service for prevention and treatment, early detection of lung cancer. The C-Care Project and Augusta University Medical Center and the Georgia Cancer Center partnered together, and we led a team that went to public housing and offered them free cessation and free low-dose CT screening for those who were eligible.
We are the state's public academic medical center. We're the state's hospital, and we have a huge obligation to provide the highest quality care that we can for the patients in Georgia and in this particular region.
As an academic medical center, AU values our community involvement. They really feel like it's important for us to reach out and educate the public and have community awareness. So we started connecting with all the different programs here at AU Health and saw that we had a common goal, and that was lung health. Whenever we looked at some of the asthma triggers, for instance, we saw that secondhand smoke was a big thing in contributing to the illness of some of our children.
When a person smokes or when a person is around smoker at work and they go home, they carry the effects of that smoke and relay it on to their family. So they have a lifelong liability.
Back in the 1960s, nobody made that connection. So many years have passed, and yet still we're allowing that same exposure to smoke in the home and in workplaces. So that's how we got started with pulling in community partners and having an initiative that we put under the umbrella of Breathe Easy Augusta.
Augusta is a very large healthcare community, and Augusta University Health, I think most people would argue, was at the forefront of that. So we knew from the very beginning that we wanted to partner with them, and we were very fortunate that we had a number of people at Augusta University Health who wanted to be a part of moving Augusta toward being smoke-free.
Breathe Easy is a coalition of some amazing organizations: Augusta University, Georgia Cancer Center, Georgia Prevention Institute, the American Heart Association, the American Lung Association, the American Cancer Society, and the Family Y.
One thing that we think is very telling is that 82% of Richmond County residents actually believe that smoking should never be allowed indoors in workplaces.
We believe that everyone in Augusta should have the right to be in public places, indoors, but not have to deal with smoke.
We know that with campaigns like this, word of mouth and community support are really essential. So Augusta University Health played a large role in that.
It was such a learning experience for me to be with the Breathe Easy Coalition at the hearings. I had the opportunity to listen to Dr. Kamen, describe what it looks like to operate on a smoker and see the damage that happens to the lungs and the hearts of patients. And then listening to Dr. Martha Tingen, she stood up there steadfastly and gave statistics and evidence that was so compelling that the ordinance simply had to be passed.
When that actually passed and those votes came in, I really had tears in my eyes. It just was a great feeling to see our community pulling together, fighting for something they believed in, and to have it actually happen.
We had been 135 out of 159 as far as health rankings, and now we've moved to 124 out of 159. But the nice thing that we saw happen early on is we actually educated the public, we educated a lot of businesses, and they went smoke-free on their own.
I was very excited to hear that Augusta University Health was awarded the Community Leadership Award by the Georgia Hospital Association because they did make such an impact.
The team at AU, I would say, is just outstanding. From the beginning all the way through to each and every appointment that I attend here.
It's about the community. What are their needs? What resources can we fill to help meet those needs that will be health promoting and hopefully cancer-free?
I think this was a huge first step in the right direction.
We're just grateful that Augusta University Health was a part of this, that so many people in the community came out to support it, and that we're actually able to take this very public step to improve the public health of people throughout our community.